could you just introduce yourselves and tell us a little bit about your son and the condition that brought him here to have cancer treatment?
Yeah, hi, my name is Santosh and it's my wife Sharine and our son Devansh, right? So Devansh was diagnosed with stage 4 high-risk neuroblastoma. Interestingly, pretty much on his 3rd birthday. He spent his 3rd birthday in hospital being diagnosed. It was almost a chance finding because he had a sort of a lump on his on top of his collarbone. And you know, after a couple of visits to the GPs, we were referred to Westmead Children's Hospital. And after a series of scans, the diagnosis was made.
And how long ago was that?
So this was about 12 months ago. So we've been about 12 months into treatment now, and we've got a couple of more months to go. Okay,
and do you mind telling me just the sort of treatment your son's been having? Or I should say Spider-Man, because at the moment he is Spider-Man. So what are the treatments he's having?
So he's having what is known as the multimodal treatment. So, you know, it's the work. So we started with chemotherapy, and then we had a resection surgery to get the primary tumor out, whatever was remaining of it. Then we had, high-dose chemotherapy with stem cell rescue, also known as bone marrow transplant, followed by radiation. And then we're currently doing immunotherapy, which seems to be one of the newer sort of treatments available.
Look, the purpose of this series of videos is to share good ideas about what makes the experience of particularly radiation treatment better for the young patient and their family. And my understanding is that your son managed to have radiation without a general anaesthetic, even though you're a very young man. So what do you think made it possible for your son to have radiation treatment without a general anaesthetic? What helped you and him that much?
Yeah.
So I feel the support workers, they helped a lot, and the social workers. So support workers in the sense, like when he came in for the radiation, the support workers were there with the toys, and they did a dummy, we did a dummy run as well.
And when you say a dummy run, what do you mean?
Yeah, so
yeah,
going
Woody.
inside.
Did you have Woody?
Woody, yeah.
Yeah, we got Woody lying on the
lying on the bed, and then operating the machine, and he saw that he pressed the buttons to, like how to operate it. So yeah, that helped us. I think that helped him more. Yeah.
And did it help you?
It absolutely did.
Yeah, it did.
Yeah. I think we also have been very transparent with Devansh all throughout. We sort of put a bit of effort into sort of prepping him in advance, and sort of coaching him what to expect, just so that he's very comfortable. Look, I must say that there's been really high emotional intelligence within the multidisciplinary team, which has gone a far way of not only helping us but making Devansh feel very comfortable.
Yeah.
And when you say emotional intelligence, tell me what you mean, perhaps some examples.
Just being very, very patient with kids.
Yeah.
We had our the oncologist who took care of us, Dr. Jennifer Chan, who visited us quite often before the treatment, when we were admitted in hospital having chemotherapy. So I feel that she sort of built that bridge, and sort of removed any barriers beforehand. I thought that was very nice, and sort of gave, at least I would like to think, gave Devansh a comfort level with her. And just being very patient. The whole nursing staff and the radiation technicians, they've been very patient with us, because we had a few runs, and just being open, being very not very formal with us. I thought that really helped. Yeah. It felt like we were with friends, to be honest.
Like a family.
Yeah, and family.
Gee, that's a tribute, isn't it? Hey,
Yeah.
I mean, we're working people, having a culture where people feel like friends. That's not easy, is it?
Yeah.